Well, good afternoon, everybody. My name is Lee Schwartz, and I'd like to welcome you to our webinar for dental practices. Today's topic is dental staffing stats, trends, and tips. So we will jump in here in just a sec, but a couple of quick housekeeping items. If you have a question during the webinar, open up the chat box in Zoom and submit your question to all panelists. We're going to try to leave a couple of minutes at the end for Q&A, but let me warn you, we've got a lot of ground to cover today, so I'm not sure how much time we'll have. Also, we are recording this webinar, and you'll receive an email with a link to a survey, as well as our SVA resource page where the webinar recording will be made available. Now, many of you are already clients of SVA, and we'd encourage you to reach out to your SVA contact if you have questions coming out of this. I'd also encourage you to share our contact details with other contacts in the industry who could use our help. You know, the one thing we've learned over the last year and a half or so is that there are a ton of practices that aren't getting timely or knowledgeable advice from their CPAs or their advisors. And obviously, we're happy to step in and help. Now, if you're not a client and you have questions, please reach out to me and I'll get you connected to a subject matter expert who can get those questions answered. Okay, so in late August, we conducted a survey with practices all across Wisconsin to gain insights into salaries and benefits in the dental industry. Now, we made two main commitments to anyone who participated. Number one, if you provided information, you'll receive a summary of the study, which will actually come out early next week. And we ask that you not share this information with others. Please keep it confidential. If you know someone who'd like access to it, please reach out to me and we can discuss ways to get them the info. But we really want to encourage participation in future surveys, so we'd like to keep it limited. And number two, we'll fiercely protect your data. So we're not going to dive deep enough into this data or provide answers to questions that will identify any individual practice information. Again, we really want to encourage people in future surveys to participate as much as possible. So if you've attended any of our past webinars, you are already familiar with our presenters. But let me introduce you, just in case, to Andy Slinger and Matt Vanderloo. Andy is a principal in our healthcare practice, and Matt is SVA CEO and also a principal in our healthcare practice. Both Andy and Matt work with dentists all around Wisconsin and really the Midwest to help them minimize taxes and maximize profitability. So I'll be back towards the end to wrap up, but Andy, I'm going to let you take it from here.
Thank you, Lee. And thank you again to all of you for joining us today. We are very excited to finally be able to roll out this information. It's highly anticipated, greatly needed in the dental community. Before we get into the actual survey results, I thought it'd be good to just kind of start with high-level trends that we're seeing in the dental industry. You all love to know and are very curious what's going on with your peers and what we're seeing. We love having those conversations. So we'll start there. Then we'll get into the data. We like to say that the numbers don't lie, the numbers tell the story. So we want to start with the trends and then see how the numbers correlate to what we're seeing. And then last, but maybe most importantly, it's what can you do with this? You know, we're all in a very tight labor market. We all have a lot of challenges right now. What can you use this data for? And what are we seeing, you know, in the market? What are we recommending to a lot of the people that we're talking to? Okay, so let's get right into some of the trends. There's the understatement of the day. We are in a very challenging labor market, okay? You all know that. Starting with hygiene, you know, dentists that I talk to, booking out farther than maybe you ever have, okay? Maybe 4 to 6 months in some cases, especially for those early and late day appointments. In the executive summary of our survey that we'll publish, I state a quote from the Journal of Dental Hygiene that states that 8% of all hygienists have either temporarily or permanently left the workforce, you know, since the start of the pandemic. You multiply that by the number of hygienists, there's a big shortage, okay? And, you know, in some cases that lack of that additional hygienist or that turnover is hindering, you know, your performance. It's hindering your ability to grow. You have all kinds of patients, but you just don't have that hygienist. Same thing goes on the associate side. very hard to recruit right now. And you're thinking not only of that salary, the bonus percentage, the benefits, how do you recruit that right associate to your practice? They're very high in demand, and that compensation package continues to see the upward pressure. The other thing you're seeing is, while you're seeing, as many patients as you can handle, you continue to see downward pressure on your collection percentage. And yes, this continues to be in many cases in Wisconsin, the Delta effect, okay? And if I were to look at your collection percentage, you're probably in that, low 70s at this point, depending on the specifics of your practice. And so I want to remind you, this is a newer thing, but as you continue to see that downward pressure, make sure that if you have bonus programs in your practice, either for the team, the hygienists, the associates, make sure you're considering what you're actually going to collect on that production, not just what you're producing, okay? Because that continues to be lower, and you're getting pressure from both sides. Remember, you have higher labor costs, higher supply costs, higher lab costs. So you're getting pinched on both ends. So you really need to consider how those bonus programs are being calculated. If we then go to revenue, very high revenue year for many of you. There are exceptions that I'll talk about. And remember, you can't really compare to 2020. 2020 will always be that asterisk year, right? It's never going to be a good benchmark year. So really, when you're looking at your data for 2021, you should be comparing it to 2019. And again, very strong year with some exceptions. What I just said, if you're down a hygienist and you can't replace, well, obviously that might be hindering your performance. Same if you've had an associate that has left your practice and you haven't been able to replace them. Either it's hindering your performance or you're working more than you want to without a day off in many cases. Balance sheets are flush with cash right now. Typically, if you rewind 2-3 years, the call would be, hey, I've got a lot of profit, but I can't pay it out to myself. Now it's reversed. There's a lot of cash. And now the question is, how do I get it out of the practice efficiently? What do I do? In many cases, your debt is in a good place. You've paid it down, you've refinanced it. There's not a lot more you can do with paying down your debt. You can find a way to take it out efficiently, tax efficiently. Other than retain it in the practice, the other thing we're seeing is investment in the practice in many different ways. Okay, maybe you've had those repairs that you've put off because they haven't been a high priority, or you're finally doing that build out. Equipment, great time to buy equipment. Okay, we always talk about it for tax purposes. Well, now you have the cash if you decide to do it right now. A lot of practices are looking at expansion because they have so many patients. It's a great time to do it. Even with the soaring construction costs, still seeing a lot of new construction. And I think it's related to the fact that you have the cash available for the down payment to meet the bank demands. And also interest rates continue to be at or near all-time lows. The other thing I wrote down, I was talking to a couple dentists. I think there's some investment going on too for the sake of the staff. Matt's going to talk later up how important culture is in your practice. And I think you're seeing the spruce up of the break room or of that room where you have your huddles, that collegial atmosphere. Because in this market, you really need to attract and retain those staff. You need them to want to come to work to your facility and to be collegial and spend time together. And so I think you're seeing some investment too in those collegial areas in the practice. And, last but not least, in some of these trends, as I mentioned, while you're seeing the downward pressure on your collection, you're seeing the increased costs for not only your labor costs, but your supplies and your lab as well. Okay, let's see how the data then corresponds to those trends. So Lee did a fantastic job on introducing kind of the background for our most recent version of the salary and benefits survey. So we thought we'd kick it off, get a little interactive here, and a really easy poll question. Yes or no, did you participate in this year's survey? If you did, in advance, I'll say thank you. And if you didn't, I have the chance to. I hope that in the future you are able to. Because I think the goal will be to just continue to expand this and to make it something that you can, really use as a tool. Wonderful. Look at this, 84% of you that are joining us live on the call participated in our survey, 16% didn't. So as I mentioned at the beginning, highly anticipated. So I can tell that you're chomping at the bit to get to the data. So let's get right to it. Wanted to give you a visual on who participated, then we'll get into the actual numbers that you're seeing on the screen here. But again, visually, you can see the concentration in the greater Madison area there in South Central Wisconsin, and then the greater Milwaukee area in Southeast Wisconsin. But as Lee mentioned, we're very excited that this was expanded for the first time statewide. And again, the hope that in future versions, you'll just continue to see this map fill in so we can get a really good idea of what's going on, and at the same time be able to then dissect the information as necessary by geographic location. As far as then the specialty, probably not surprising to you here, or not surprising to you, is that of all of you who participated, 80% are general dentists, so 8 out of 10, but very happy to see that we did get some specialty practices. The wonderful thing about slicing and dicing the data is we can obviously look at orthodontics, for example, as a specialty. We can look at pediatrics as a specialty, which I can anticipate, we'll get questions related to that as well. You saw the visual on where people participated from. Here is the actual numbers. Again, 18 outside, and then you see the concentration in South Central and Southeast Wisconsin. Another important factor is, well, what size practices are participating? Okay, so again, you can see that for the most part, you got your small, closely held dental practice with likely 1, 2, or 3 dentists practicing based on the size. But you get 52 at under 10, 27 in that 11 to 20, 19 in that 20 to 50 range, and then just 2 very large practices that participated. Okay, as far as the actual data, as you know, what you get is only as good as the question that you ask. So we took a lot of time to be very careful on how do we ask enough, how do we get enough information, but not ask too much where we're deterring people from responding. So we decided that by position, we would put people into 3 different buckets, okay, based on experience in the practice. So we had 0 to 3 years, we had 4 to 10 years, and then we had 10 plus years of experience. Okay, that's our 3 buckets. And then we asked, what is the average rate within that bucket by position? Okay, we didn't get everybody's individual salary or hourly wage. We just got the average in the bucket by position. And then, so basically what you're going to see is by category, by position, you're going to see the average of averages as reported by each individual practice. So going position by position, first we start with the broad category of front desk employees and receptionists. All right. And again, we did our best here to take the outliers out, okay, because everybody has special circumstances for various reasons. So we tried to take those out because we didn't want to skew the data one way or the other. The focus today is on these averages, okay? Look at the maximums because you all have your unique situations. Look at the minimums, take them with a grain of salt because in this labor market, you probably don't want to be down in that minimum range, okay? But take a look, focus at the average. And you can see a nice tier here, what you would expect based on experience, starting out at that $18 an hour range, going all the way up to about just under $25 an hour, which makes sense as you grow in experience. Next, we'll look at business and office managers. And question we'll get, a lot of times these positions are quoted as an annual salary. Okay, again, just to try to get consistent data, we asked for the average hourly wage. Now, I did some quick math. Everybody has different hourly expectations as far as how many hours are put into that year if it's a salary. But if you just take the $29 here, assume a 40-hour work week, 2,080 hours for the year, you come up with about $60,000. Okay, so that's your number. If you're looking for an annual salary, that's your plus or minus. Right in the middle, there's probably that $60,000 depending on experience for a business or an office manager. Next category, we tried to differentiate, okay, between that previous category, front desk and reception, versus office assistants, filing clerks, billing clerks. As you all know, the smaller the practice, the more overlap in these tasks. Okay, the bigger the practice, yes, you might have a more delegation of duties. But again, if you remember who's participating, a lot of smaller practices, a lot of overlap of duties. So not surprisingly, if you were to take the slide 2 before this one and compare it to this one, almost identical in your tiers, ranging from, you know, just over $18 on average up to about $24 with more experience. Okay, dental hygienists. A lot of you been waiting for this slide. A lot of upward pressure here. So notice very firmly in those mid 30s into the upper $30 per hour. Talk to a lot of dentists who have their hygienists in the $40 tier. Okay, so not surprising to see that. And, you know, the minimums, again, remember, probably fresh out of school, possibly based on geography, but, you know, clearly, you know, the line to look at is that average in the mid to upper 30s is where we're really starting to see that for hygienists. Keep in mind, again, this is as intended, just the hourly wage. Some practices may have, you know, a bonus tied to production on here, you know, along with a benefits package, which Matt will get into later on in the presentation. Next, we'll look at assistants. Pretty cut and dry here. You know, I put a lot of attention today on hygiene and associates, but there's a need for assistants as well. A lot of practices are looking. So again, you have a range here. The average of averages 18 plus up to just under $24 per hour. All right, employed and associate dentists. You know, on the high end, consider that report for those maximums, very specialty practice. Okay, you could easily, if you're a general dentist, consider that an outlier here. Again, the same question is, a lot of times this position is, we get the call, what's the annual base salary? Okay, so I crunched some numbers. Let's take the lower end there, that average. Let's take that $81 an hour. Everybody's different, but let's assume a 4-day work week. Let's assume a 50-week work year. You're right at around $130,000. Okay. Take that middle, take that $96 per hour. Same thing, assume the 4-day work week, 50-week work year, you're at about $150,000. Say, not surprising, okay? Lower end, someone fresh out of school, you're probably at the low end at about $130,000. You got someone with experience, the capability, the earnings potential goes way up. And so it's 150, and we're seeing it north of there, okay? And then remember, on top of this, many practices will have then a production incentive. Once you meet a minimum threshold of production, anything in excess will likely be compensated at a certain percentage. So there is your associate dentist. All right, perfect time. Now that we've gotten through the salary wages information, I thought this would be a great time to turn it over to Matt. He'll give you the next poll question and then really go into the benefits side of the survey.
Yeah, thanks, Andy. So our next poll question here, with what you've heard so far, based on what you've learned so far, where are your salaries in comparison to the marketplace? A little bit lower, a little bit higher, right in line with the market? Love to hear your feedback there about what you're thinking. And, you know, a lot of you have already participated in this, so we should, your numbers should be in this survey data, so we should have some good information, should hopefully have a lot of people that are really close to market. And we got, you know, about 78% of you, so the vast majority here have salaries that are well in line with the market. A couple practices that might be a little bit below market based on what they've seen before, and a few that are just a little bit higher than market based on what we've seen so far. Some other, you know, Andy went through a lot of great wage information, salary information there, but we tried to include a lot of other good information in here, some great questions about benefits. So one of the first questions we did was for those associate dentists, employed dentists in your practice. Are they paid any kind of bonus based on a percentage of hands-on production above some sort of a minimum threshold. About a third of the practices don't have an associate or an employed dentist in there, so they didn't answer that question. So we've got about a third we throw out. And then for the other 2/3, it's pretty evenly split, 50-50. About half those practices do have some sort of bonus percentage for the employed physicians, about half don't. And as we talk about and look for some opportunities in here, we see a lot of practices that are having difficulty hiring that associate, attracting that associate. This might be one opportunity here. If you're one of the practices looking for an associate, having some sort of bonus program in place for your associate could really be something that differentiates you from a lot of the other practices out there. So something that's worth looking at and considering, and if structured correctly, can really be a win-win for both the practice and the associates there. So something to think about there. And then that average percentage, we got a pretty big range there from 5 to 40%. So lots of different percentages being used, but we're averaging in that data, the average is right around 30%, which is what we're seeing in a lot of practices as well. So a good percentage there to think about if you are thinking about putting that kind of a program in place. Also asked about vacation for full-time associate dentists and CME allowance for full-time associate dentists and where those range. On the vacation side, a pretty wide range, 1 to 4 weeks a year, but averaging about 3 weeks a year is the most common answer there. And then on the CME side, that allowance, again, a really big range, $1,000 to $5,000 per year, the average being $2,000. We also had several practices give us some information that they're also offering additional time off over and above the vacation for CME during the year, and the average there being about 3 additional days of time just to do continuing education every year. Lots of different benefits being offered in practices out there. And you can see there's a lot of practices that are doing a lot of them. Almost 2/3 of practices offering health insurance, almost 75% of practices offering some sort of uniform allowance. So most practices having those 2 benefits in place for employees, something that if you don't have, you might need to think about getting in place here to be able to keep competing for staff and for talent in your marketplace. And then lots of other benefits that are being offered, but not with as much frequency between practices as health insurance and uniform allowance. Lots of practices that are offering long-term disability, shoe allowance, short-term disability. Larger number of practices offering the dental insurance. So we're seeing there almost 2/3 of the practices having some sort of dental insurance in place. And then almost half of the practices offering either a flexible spending account or a health savings account to employees. Typically, a practice is going to only offer one or the other of those based on the type of health insurance plan they have in place. So I'd look at those 2 in conjunction and say almost half of practices are offering that as an option. And then group life insurance is an option to almost 1/4 of practices offering that to employees. The other big benefit plan, we separated out the retirement plan, whether that's a 401k plan, some sort of a simple plan or some other option, but over 90% of practices are offering some sort of retirement plan to employees. On the 401k, simple IRA type plans, most practices offering a match, and that match is ranging somewhere between 2% and 6% in the practice. And then if there's a profit sharing plan, about 24% of practices are offering some sort of profit sharing plan and a regular contribution into that. And again, same range there, that annual contribution being somewhere between 2% and 6% into the profit sharing plan. So for the plans that are doing a match and the profit sharing, anywhere between 4 and 12% going into plans on average for employees. Also asked a little bit just on adult hygiene appointments, wanted to get an idea of where people were falling. And we've got a huge range for those adult hygiene appointments, anywhere from a 30-minute appointment to a few practices doing a 75-minute appointment. But the vast majority, almost 85% of practices in this survey, were doing either 50-minute or 60-minute adult hygiene appointments. And then kind of the last one, which I know is a popular question this time of year in all practices, what range of increases are you anticipating giving in your practice this year? And we had a wide range there. Some people responded that they weren't planning on giving any wage increase this year, which is hopefully the people that said they were either at market or above market on their wages, to some practices saying that they might be giving up to an 18% wage increase. So there's a big range there of people doing a lot of different things. The majority of practices on average are looking at somewhere again this year between 2 to 3%. And that's been historically pretty typical of what we've seen in practices. I think when all's said and done and people really start looking at this a little bit harder this year, I think that percentage might sneak up on the upper end. I think we might see some practices on average going closer to 4 and 5% on those wage increases this year. So lots of information there, but what can we do with it? What can we glean out of this that we need to think about going forward? What can we be putting into place in practices? I think one of the big things to keep in mind in trying to attract employees and retain employees is that culture really does matter. You definitely can compete for employees based on salary and benefits, but if that's the only way you're trying to compete, you're in a tough position and you have to be at the top of the market. The culture in your practice, those investments into the practice that Andy talked about that you might be making to help retain and attract staff are really important. A culture and an office where employees look forward to coming to work, not just because of the paycheck, but because of the patients they get to work with and the other employees and the dentists they get to work with are really important. As you're thinking about benefits and potentially new benefit plans to offer in your practice, make sure you're talking to your staff and seeing what really would be valued by them and what they're interested in. We don't want to put in place a plan that might be really attractive and the doctor might think is really attractive, but isn't going to resonate with the staff and isn't going to hold a lot of value to them. If we're going to add new benefit plans with the idea being to attract more staff and retain more staff, let's make sure we find a plan that's of interest to the employees in your practice. As you're thinking about those 2022 fee increases, take into account these rising labor costs, those rising supply costs, the rising lab costs. Your input costs and practices are really going up and have gone up dramatically over the last 24 months. Make sure you're building that into your fee increase and that you're pricing services appropriately for all those input costs. Now, I know a lot of you have a lot of Delta Dental patients in your practice, so it doesn't matter what that fee increase is. On a lot of patients, you're not going to see any change in reimbursement, but I still think this is an incredibly important step for you to take to make sure you're accurately reflecting what the true cost of delivering high quality service to your patients is, even if reimbursements right now might not be keeping up with that. As you sit down with staff to do those year-end reviews, annual reviews, make sure you're giving them some sort of presentation that puts their entire compensation package in front of them. You don't want to focus only on the salary they're getting, but build in all the costs that they're getting as a part of those benefit plans. What are you paying for health insurance for them? What are you putting into the retirement plan for them? And really give them a great idea and let them know exactly what their all-in compensation package looks like with all those benefits. It's often very difficult for staff to glean that information from their pay stub or from the other documents you're giving them. So put it in front of them when you're doing that annual meeting with them. We see a lot of practices that are going to do some sort of a raise. Another thing to think about, it's been a difficult 24 months in a lot of practices. A lot of employees who've been in the office then had to go home and came back to the office, maybe worked a lot more as you got through some built up demand in your practice. One thing to think about in addition to the raises, there might be an opportunity to give some year-end bonuses or some spot bonuses to employees who've really done a lot of good things in your practices these last 24 months. The one big benefit of those bonuses is that they're a one-time pay to staff. They don't get added to their base salary, so that next year when you do another 2% increase, that bonus is in there too. Doing the bonus keeps it out of those annual increases. And now's the time, as you have those demands and it's tough to keep up with staffing, to get really creative with your recruiting and get your staff involved. The hygienists in your practice, no other hygienists, the assistants, no other assistants. Get them involved in the recruiting practice. Let them talk about your culture. Let them talk about your practice. Let them help attract talent to your practice, to get people in there to help meet your demand for staffing to keep the practice going. One more poll question here before we turn things back over to Lee. Lots of information we've packed into the half an hour here. Any plan to make any changes based on what you've seen so far? So a nice split there between people who are looking to, are going to make some changes based on what they've seen, and people who we've just overwhelmed with a lot of information here in 30 minutes and probably need some more time to digest it all, look at it all, and see how it impacts their practices and what they might want to be doing a little bit differently.
I think you're right about that, Matt. I think that's a lot of information, and it's tough to take it all in and answer that question off the cuff. But great job, you guys. I knew it was going to be hard to keep it to a half an hour. You guys managed to do it by the skin of your teeth. We had a few questions come in. They were very specific. I want to sort of table those, and we can reach out to you folks separately to get those questions answered. But one of the things I know we did cover and will be in the actual final survey is some more specific geographic information broken down by South Central, Southeastern, sort of rest of Wisconsin. Can one of you sort of address, I guess, sort of some takeaways, what you saw in that data?
Sure. I think, what we saw, we've long suspected that that South Central region was a little bit ahead of Southeastern Wisconsin and the rest of Wisconsin in salary and wages, but haven't had good data to support that belief up until now. I think one of the great benefits of having something this wide reaching and get this much feedback is that we do have some confirmation of that now as we look. And when you get the full survey and are able to look at things, we do see that there's South Central Wisconsin's ahead of all the other locations regardless of experience or position.
Okay, great. And just another question that just came in, I think we'll reach out to you individually as well. I think one of our goals is to make sure that we're providing important information that you can use. Unfortunately, when we have some cross sections of data that aren't quite big enough, we can't share that again because we want to be very respectful of the information that has come in. So as we wrap up, I just want to remind everybody, especially those of you who did complete the survey and are going to receive the results, please keep this information confidential. We want to encourage as many practices in the future to participate. But if you do have somebody that you know, or if you have additional questions, please reach out. If you're a client, please reach out to your SVA resource, or if not, please reach out to me and we can try and get you some answers to some questions without maybe giving away too much. Our next dental webinar is going to be on November 18th, and the topic will be year-end tax planning 2021. What's new and what you need to plan for. So we appreciate all of you jumping on. Have a great rest of your day, and we hope to see you at our next webinar on November 18th. Have a great afternoon.